it's really interesting when you talk about that security stack. I mean, a big piece of that is endpoints. And we know that endpoint security matters a great deal in healthcare, because if clinicians can't get to systems quickly, it can compromise patient care and client care. What can healthcare providers do to better secure endpoints without impacting clinical processes?
Yeah, I mean, securing clinical endpoints doesn't mean that we lock out or lock down clinicians, right? It does mean, though, that we need to design around how care is delivered, right? With the right tools like Microsoft Intune, Azure Virtual Desktops, and Defender for Endpoint, we can make sure that updates and patching and threat response can all be done without clinicians lifting a finger. We don't want the clinicians involved in troubleshooting devices or being hindered by IT systems. We want them seeing the patients, right? More importantly, I think conditional access ensures only authorized, compliant devices connect to those sensitive systems, even when you're offsite or you're using a BYOD endpoint. Yeah, we can even tailor those access based on location or role or risk, all without interrupting those workflows that are so important for the clinicians. For me, it's about making sure that we have invisible security that moves at the speed of care, not security that slows down that care. Right?
Yeah, I think that's the key there, is you want to make sure that it enhances, doesn't get in the way.
Correct.
Yeah. Look, access control is obviously a big deal. We want to make sure that people can only get to the stuff that they're meant to get to when they need to get to it. Where does access control fit into this? And we had an audience question that's related to this, which is around what's the best way or the most effective way to manage privileged access management as well? So I think those things kind of all roll together. Who wants to jump in on that one?
I think access control is mission critical, especially in healthcare, like you're saying. Clinicians do need rapid access to patient data, but that patient data must stay protected at all times. And when we look at how AI can enhance that access control, it's really exciting area to be in, right? Because we have adaptive policies that respond to the risks in real time, like flagging unusual logins or triggering extra verifications, right? These type of capabilities can be game changers for SMB teams, right? But AI, you should also not forget that AI is also a threat actor as well now, right? So attackers are using generative AI to craft realistic phishing, deep fakes and spoofing identities and automation brute forces and things like that. So it's really important, I think, that SMBs rethink their identity, not just as a login, right? But it's an active security service. Implementing things like least privilege, conditional access, and NMFA, and continuously monitoring all of those things, right? That's now the new baseline. And I think it's important that we make sure that we get AI tools across the whole landscape here. That access control, I think, with AI augmented in, becomes not just the security, but it becomes security at scale for us, right? And without it, I think you're basically flying blind. And to talk to the particular question there, Anthony, from the things, I know at cubesys we're obviously very, very centered on Microsoft technologies, but that privileged access management using PIM inside of Azure is something that we talk to a lot of our clients about.